you guys saw that that fold went back down. What do I do? You got to go underneath it. Right, you got to go on the inside because I'm sterile. Okay, so I take my Q-tips and all my stuff, and I'm just going to kind of toss it on here. Okay, and then now that I've got this all set up, now I'm going to have one sterile hand and one non-sterile hand. Okay, so this will be my non-sterile hand, which will just be my clean hand that I'm going to do everything with except the sterile stuff. So at this point in time, I'm going non-sterile now. So this hand, I'm going to take the saline. Oh, whoops, you know what I forgot? I need to make this little basin. So open your basin too. Okay.
Hey Jen, what's the point in having that other little box thing if you're going to dump the fluid in the plastic bin?
Keep watching. You'll see. Okay, so you put the water here, here, and here, and then you put the water over here in this.
Do you put a lot? Like more than that?
Yes.
Okay.
When you're doing it in real life, you'll dump the whole thing full.
Okay.
But we are not doing that today because we're going to dump the water down the sink somewhere. Okay, so then you take the peroxide. Once again, you dump the peroxide in the big bin because that's where you're going to be cleaning your trach. Okay? Only the big bin. Then I'm going to turn on my suction. I don't know if you guys can see it. So I go, whoops, it's supposed to be off. So I turn my suction on. With my clean hand. Okay, then I take this suction catheter because this is what I'm going to end up hooking to my patient. And I put the suction catheter, I'm going to just set it on the patient's bed. So this is the suction tubing that is going to be, that I'm going to hook this suction to this. Okay? Okay. Once again, that's with my clean hand. You guys have seen that this hand right here has stayed sterile, right? I have not touched one thing with this hand except my sterile stuff. Okay. So the next thing that I'm going to do is explain to him that I'm going to be taking out his inner cannula. So I take out his inner cannula and I just pull it out. And I circle it around and dump it right into my cleaning bin. Okay? Now we're going to suction him. So before we suction him, he needs to hyperventilate. Like, not really hyperventilating to where we're, but we need him to take some deep breaths, hold it, deep breaths, hold it, so he can hyperoxygenate is what we really want. So we explain to him, we have him do that, ask him if he's okay. Then we are going to take, with our sterile hand, you're going to take the suction catheter. This tip right here is going to become non-sterile in just a moment. Because I'm going to take my clean hand and I'm going to hold this and I'm going to plug that in right there. Now, is this hand still sterile? Yes. This hand is still sterile. Then I'm going to explain to him that I'm going to put this down inside till I meet resistance. So I'm going to do that now. Mr. Jones, I'm going to do this. Put this in down your throat. We're going to get the suction going. So are you feeling okay? You want to make sure that he's not dyspneic, that he doesn't have any questions before you do this because you're going to be blocking his airway off. Okay?
Should you moisten
Yes, you should. So before you do that, good call, Alanda. You should moisten it. So I usually just stick it in here. Actually, what you're doing is testing the suction. So you should test the suction. And in order to test the suction, you have to push this, and that will suction. As long as it's open, it will not suction. Once you put your thumb across that, it'll suction. Okay? So yes, you want to moisten it, and you want to test the suction. Then you slowly put it in Mr. Jones's throat until you meet resistance. Once you do, you apply suction and slowly rotate it as you're pulling it out. Rotating it keeps it from getting stuck on one side of the throat or another. So you do that for about 10 seconds, no more than 10 seconds. Okay? Then you clean out the suction again. If you have to go down again, somebody asked this, you have Mr. Jones hyperventilate again. Take some slow deep breaths to where he feels okay. Then you can go ahead and go down again and apply suction. And I don't ever apply it totally with my thumb on it. I kind of alternate it. Okay? While you're rotating for 10 seconds, you're watching for dyspnea. You're watching for him to turn blue. You're watching for pain. You're watching for any of those things while you're doing this. Okay? Then, once again, rinse out the suction tubing. Then, with this hand, coil the tubing up. Pull it out of there. And you're going to turn the suction off with your left hand. And then you're going to take this glove and pull. And isn't that a fancy little pouch? So then this is pretty much self-contained. And then you take your other glove off too. Okay. Then you are going to, while this is like this, I'm going to take this part and be rid of it, which is the part that's got all your suction stuff, and it's going to be gone. Derek, do you understand now why we poured that one in there?
Yeah, just on that YouTube thing, they used to use the water in the other box, the other basin.
Yeah, well, our thing came with a fancy little square basin, so we get to do it a different way. Okay, so then you're going to do hand hygiene in between. You're going to ask him if he's okay, and then you're going to explain that you're going to, change his dressing right now. You're going to tighten that back up and see if he's still tolerating everything all right. Okay? Okay. Now, I'm going to touch the bottom of this. Maybe I'm not. Maybe it would be worse if I do that. Okay, I won't. I think it's going to. I'm just trying to get it to where you guys can see. Okay. All right, so now what I'm going to do is we've got to don some sterile gloves. And I checked my sterile gloves. You saw them, they were there. So I've got my extra set of sterile gloves. Or you can use the ones that came in that pack if you want to leave that out, whatever you want to do. This is why I like bedside tables, because you can sit and move the thing around and keep your sterile soap. Okay, so once again, you're going to put your sterile gloves on. And I can't remember if Amber told you to go non-dominant and then dominant, or dominant and then non-dominant. Do you guys remember?
I thought it was dominant then non. I don't know.
Okay.
Whichever is more comfortable for you.
Is that what she said? Okay. All right, so I'm sterile again. And I'm moving my sterile field so you guys can see. All right. Okay, so with this hand is going to become my clean hand again. All right. So I'm going to take the tip of the cannula that is not considered the sterile part. Then with this hand, my sterile hand, I'm going to take the wire brush, dip it in here, and I'm going to clean the outside of the cannula. All right? Then I chuck that. Then I take a pipe cleaner and I clean the inside of the cannula with a pipe cleaner. Chuck.
Did you dip it in the saline?
No, I just dipped it in the cleaning solution.
Oh, okay.
The cleaning solution. Okay, and then with this one, I'm dipping it in the saline, the sterile saline, and I'm going to clean the inside of his outer cannula. So I just stick that down inside there, not far, just far enough that you can get the gunk out of just the opening area. Okay, so I'm going to clean that, check that. Then I'm going to take this, rinse it in the water, the sterile water, take a 2x2, and I'm not going to slip and splatter it like she did. And you just slowly dry that off, throw that down. Then you're going to take this and you are going to put this back inside Mr. Jones and lock it in place and make sure it's clicked and secure, okay? Then with this hand, you are going to take the old dressing off and chuck it. Then with your sterile hand, you're going to take the Q-tips, dip them in the sterile water. With your non-dominant hand, you're going to secure this. And then with the sterile hand, you're going to clean around the stoma. Can you guys see that? I don't know how well you can see. Around the stoma. Then chuck. Then get a new one. Dip it. Clean. Okay? All right. Now at this point, you are no longer sterile, because you now have to touch all the outside with both hands. Okay? So you get your new dressing, and you put your dressing around the patient's stoma, like so. Okay, and you're making sure all the while that this is secure and everything, and that he's not having difficulty breathing. Okay, now, the last thing you do is you take your straps or your phalanges, and you take it and you put it through one side, and then you double it, like this. Whoops. You double it like so, okay? So it looks like this. Then you wrap it around the patient's neck, making sure that there's no folds, all right? And it'll make it around their neck, unless they're a big, giant football player. They might not, I don't know. And then you tie it securely right here, making sure that it's secure and that it's not too tight, because if it's too tight, it's going to irritate him. So you just want to make sure that you've got a finger or two that you can go underneath that, okay?
You just use one side and then tied it with the other side?
Yeah, I put it through this side and then just only tied it on one side. Okay? Then after I do that, then you can take the other one off, or you can cut it. Yes, I can't get this one tied in 40 knots. Okay, so then you get that one off. You take it off. Sorry. And then after you do that, you're going to assess that they're secure. You're going to teach Mr. Jones that he needs to not play with the little phalanges, and if he starts feeling irritation or whatever, to let us know. Also, you're going to teach him that if he has the need to get secretions removed, that he needs to push his colite and us get in there before he becomes hypoxic. So there's several things that you need to teach him. The other thing is oral care. You want to provide oral care for him, because a lot of these patients, they don't breathe, and they don't get their mouths don't get used much. So you want to provide oral care for Mr. Jones. And go ahead and do that. Then you're going to document any redness or swelling around the site that you saw. You're going to want to document how he tolerated it. You're going to want to document what the exudate on the old dressing looked like, and different things like that. Then you're going to, obviously do the end procedures where you throw your gloves away, and you put his bed back down, you put his side rails up, make him safe, leave him comfortable, and then just your basic exit care. So, do you guys have any questions? Claire? as mud? Okay, so you guys can see that that's really pretty technical.